William Hutchison, Armenia Colombia Realty for expats, and Salento Colombia Realty. Own them both with Alba, my wife. Just as a little bit of an aside, I thought I was the big dog in this company, but I'm not. I have to admit, I couldn't do 75% of what I do if I didn't have Alba. She's absolutely invaluable to the company and to the direction that we're trying to move things. Today I want to talk to you about EPS, and EPS is just the umbrella for the insurance companies here in Armenia. I suppose the system is you go to the insurance company, you have the procedure, they bill the government, and the government pays them. There's one for people that are struggling. I think it's called Sanitas, if I'm not mistaken. Don't hold me to that because I'm not 100% sure. But I want to give you some concrete costs and some examples. The questions I used to get on the channel when I first started, it was in April of last year, so 15 months now, were all about safety. I haven't had a safety question, I don't think, in 6 or 8 months. But all of the questions now that are coming in are health and visas. And we have English-speaking people on our team that will help you with those things. They're open for any kind of questions. In fact, after seeing this video, if you have some questions and you want to get a hold of me, I'll put you in touch with them. I used to be pretty good, I think, with visas, but when President Petro came in, he made a lot of changes, and I just refer everything to our visa lawyer, Maria. And then, of course, all of the EPS health goes to our EPS expert. She's bilingual, but married to an American, and he works with her. So let's get to the details, and just to give you an idea of what's going on. I've had a couple of occasions recently to get premium quotes, and I'll just tell you the two of them that I've had. 67-year-old from Los Angeles, full coverage is going to be $38 a month, and a fella married with 2 children, his is just over 60. Now that's full coverage, and I'll get into my particular situation here in a minute. Tomorrow I'm going for a Holter test, which is they put the monitor on your heart for 24 hours. I've had that done maybe 6 months ago. The one thing that I want to say before I forget is Sura makes your follow-up appointments. They don't leave it to you. I mean, it's unbelievable. I'll get an email and the appointment will be out 10 days, and it'll basically say, Bill, you're scheduled for this test next Wednesday at 4:30, and they give you the address because the medical facilities are spread out over the city, and be there. And that's the end of it. You don't have to make sure that you're doing your follow-up because the insurance company does it for you. So as far as the Holter test is concerned, the cheapest I could find, and I didn't research it in depth, but the cheapest quote that I could find to have that done, 24-hour monitor on your heart, and then the cardiologist gives you the results, $606. Tomorrow I have to pay copay for that procedure, and it's going to cost me $5.50. So when I say that things here are inexpensive, you've already heard of a couple of premiums. The one thing too, you can't be turned down for pre-existing condition. It's against the law. So don't worry about it if you've been treated. I have had clients here with cancer, and they're eligible to get EPS coverage. I'll tell you how you get it at the end of the video. Now, let me say that anytime you use Sura, you pay $1.10. So if you go, you have an appointment to see the doctor, The receptionist will charge you, at today's rate, I'm using 41.50. It's 4,600 pesos, which is today is $1.10 or $1.12. If the peso gets weaker, obviously that cost goes down, but it's not anything to be talking about anyway. As far as the drugs are concerned, the doctor writes an order. He doesn't write a prescription. And Sura has a dispensary. So what you do every month is you go to the dispensary and you get your drugs for the month, and that costs you $1.10 for each. Now, there are exceptions. On the very expensive drugs, they'll charge you $2.20. Mine, I pay $1.10. So my drugs every month are costing me $3.30. And that's not unusual. That's the cost. So, very, very seldom do you need to go to the pharmacy. If you're dealing with Sura, they have that dispensary. I'm sure the other people probably do as well. We are covered with Sura, and I can only tell you about their program. Now, I want to tell you about my health scare that I had last October. I'm not going to go into the health details, but just the costs. I had a very serious kidney infection, and I was in the hospital for 8 days. While I was in there, Alba thought that I fainted, and Alba thought that I hit my head. I hadn't, but she insisted on an MRI, so I had the MRI for my head. A cardiologist, there was two that were dealing with me. The one of them said, "I think I see a shadow on your X-ray. You may need a stent, so I want to send you for an angiogram." So I went for the angiogram. It was done by a graduate of Harvard Medical School. He'd worked in Toronto, Montreal, and Boston, fluent English. And he, after he did it, said, "There's no need for a stent. Your arteries are wide open." And the one thing that we agreed on was that maybe some of that had to do with the fact that I've never smoked a cigarette. But he did that. I also had the full blood, including the one that tells you how well your organs are working. And what else did I have? An EKG. So that was the 8 nights in the hospital. The one thing I want to say about the angiogram is the doctor went in my right wrist, and I checked it out after the Mayo Clinic and Cleveland Clinic. I use those as health sources, and it's the latest technology. I guess in a lot of cases they don't go in your groin anymore. I didn't feel a thing, not one thing. So I came home for about 10 days, and then I went back for prostate removal, and it was done by laser. And the doctor didn't put me out, he just gave me an epidural. So I was only numb from the waist down. Hour and a half by the time they prepped me, and had the epidural and completed the surgery. So I was in for 3 nights then. So the summary of all of that, I'm on copay with my wife's policy where she works. So for the 11 nights, all of those tests, all of those procedures, I paid $315. That was the bill that I got. It's amazing. I mean, I'm hearing some numbers from, the US, and even if you're not paying them, there's some insurance charges that I just can't believe. But I guess that's the way things are now. So that's the summary of what you're looking at in general terms. I mean, these are specific to me. Every situation is different, but the premiums will give you some idea. I guess if you're a couple and it's $38 for a single, I doubt it's double for a couple, but you might be looking at $60 or $70 a month to get the type of coverage that I have. If you have any questions about the insurance, get a hold of me. If I can't give you kind of a general answer, I'll put you in touch with people that can. And visas. You don't have to be a client now. If you're looking to do a visa, then we have Maria, and that's basically all she does all day. The one thing I will say to you is you're going to come here on a tourist visa. You'll get 90 days at the airport. You can renew it for a further 90 days locally, so you can get 180 days without getting any sort of a retirement, a digital nomad visa. The way you get EPS though is that you need a cedula, which is a national identity card, and you can't get a cedula unless you have a permanent visa. So if you're planning to come here on a tourist visa and to get this insurance coverage, sorry, it's not going to work. You can't do it on a tourist visa because it's not a permanent visa. That's it for today. Get in touch if you have any questions about insurance, visas, or anything else. I'll be happy to help you out if I can. Have a great day. I live in paradise, and you can too.